Hello everyone, I'm Dr. Chaitra, a gynecologist by profession. COVID-19 is an infection which has affected the entire mankind. A lot of questions get posed to us, the gynecologists. The fear among the newly going to be mothers is very high. One of the very few questions that I get asked is, Madam, am I susceptible to this COVID-19 infection? Well, most of the women who have or who develop the COVID-19 infection are moderate to mild symptoms. The serious complications in the form of pneumonia are more seen in people who are in the elderly population or people with a reduced immunity. But the Center of Disease Control and Prevention say that because of an altered immunological and physiological status in pregnancy, women can be prone to developing the complications as well. Women with cardiac abnormalities should definitely be more careful. The second most common questions I get asked, with your fingers crossed, is, will my child get the COVID infection if I have the corona infection? Well, the initial reporting which came from China said that there is no history or there is no recorded vertical transmission. Vertical transmission, I mean, there is no transmission from the mother to the child. But in the month of March 26th, it has been reported that there was an incidence of vertical transmission, and it was strongly associated that there was a transmission from the mother to the baby. Now, the other common questions are there any birth defects the baby can have if the mother has a corona infection? Well, the infection is new even to us. It's only been a few months and the study is still been going on persistently and extensively. Some complications that a mother may experience would be a preterm labor or a reduced growth of the baby because of the symptoms of flu. Now, apart from that, what you people really need to know will be, what are the symptoms of the coronavirus infection? Well, when you experience a little bit of sore throat, cold, cough, or fever, you should make sure that you do visit your obstetrician. If the symptoms subside in the next 7 days, then there is nothing to worry about. But if the symptoms persist or it gets worsened in the 7 days, then there is a matter of concern. Now, a lot of women also have the question of, should I go for my regular antenatal visits or not? Well, there are some tests that a pregnant woman should undergo which are time bound. Like maybe it is the 3rd month NT-NB scan or the anomaly scan in the 5th month, and to estimate the blood sugar level. Well, these kind of tests should be done at the appropriate timings. So I would suggest it would be best to get in touch with your obstetrician who knows your history the best, and then decide on your antenatal checkups. Now, again, a lot of women also keep asking, Madam, what is the test which is done? Is it an invasive test to find out if we have a corona infection? Well, no. Corona infection is tested by taking a swab from the nasal cavity as well as the oral cavity. Finally, I would like to just give you a warning. I'm sure you must have heard a lot about it in the media and the social media. You are going to be a mother, so make sure that you do practice the very strict guidelines which the government has prescribed. Do maintain social distancing. Please keep your hands away from the eyes, nose, or the mouth. Cover your mouth when you're sneezing and discard the tissue immediately. Stay away from a person who has any symptoms of corona. I wish you a very happy motherhood. Thank you.